Probably the most contentious issue right now is these efforts by drug manufacturers who are required by law to provide their drugs at a discount to covered entities. Um, they're trying to be more creative in ways that they can limit the volume of discounts that they're providing to covered entities. So one way that they've tried to do that is by trying to restrict or limit the number of contract pharmacies that covered entities can use. So historically, covered entities would enter into agreements with retail pharmacies like a Walgreens, CVS, things like that, to essentially act as an agent of the covered entity so that prescriptions that are written for that covered entity or one of those covered entities patients, and then that patient gets the prescription filled at that retail pharmacy, those prescription drugs are considered 340B eligible. And so that they can access those drugs at a discount when they purchase them. So the drug manufacturers are just wanting to limit the number of contract pharmacies that covered entities to utilize. So they don't have to issue as many discounts and save more money on the drug manufacturer end of things. We're still kind of seeing how those lawsuits shake out. But in the meantime, covered entities are still trying to have to be very nimble in how they adjust their operations in the meantime while we kind of wait to see what the final say is on this. You're also hearing a lot of voices out there that are scrutinizing the program's integrity. And if covered entities are truly utilizing the discounts as they're intended to, which is to improve access to care, improve services for patients. It kind of comes down to the basics. Leadership is really important. If you have the ability to hire a compliance officer dedicated to tracking and monitoring all these different regulatory compliance developments, reviewing and vetting contracts, making sure you're properly protected, and then guiding audit responses, making sure you have an audit team and a response team to handle those data requests that you're getting from all these different players now. And then obviously supported by outside counsel with an expertise in healthcare, because it is a lot. I mean, healthcare is one of the most highly regulated industries, I think only superseded by the tax industry. So it is very hard to keep up with, especially when you have a pharmacy to run or you are a pharmacist yourself. So really leaning on and relying on experts in their field to guide you, that you trust, will give you the right information and really have your business operations in mind. The other pieces are documentation. A great documentation management system goes a long way. You can keep up with those audit demands and respond to them pretty more timely, especially from 340B auditors, PBMs, payers. They're all going to request different information. So having that all on hand in a central location is really important.